right now as you listen to these words. An algorithm has just detected lung cancer in a 45-year-old woman who has never smoked in her life. The tumor, still invisible to human eyes, measures only 3 millimeters. In 6 months, when she would finally feel the first symptoms, it would be too late. But today, she has a 95% chance of complete cure. This is not science fiction. This is medical reality happening now in hospitals around the world, through a revolution you probably haven't even noticed has already begun. Have you ever wondered what it would be like if machines could see diseases before they exist? What if algorithms could predict your future health with more accuracy than you know your own body? Artificial intelligence in medicine isn't just about technology, it's about completely redefining the boundaries between life and death. Health and disease, possible and impossible. Where are you now? How do you feel? These questions matter because, as we explore this extraordinary transformation together, you'll discover that the medicine of the future isn't just changing how we treat diseases, it's changing what it means to be alive in an era where machines learn to heal. Close your eyes for a moment and imagine a hospital somewhere in the world. Not the cold, sterile corridors you might know, but a place where every heartbeat recorded, every image captured, every symptom reported transforms into data that dances through invisible algorithms. A place where machines learn to see what the human eye cannot perceive, where technology whispers diagnoses into the ears of dedicated doctors, where the future of healing is being written in code. Have you ever wondered how it would be if we could predict diseases before they even manifest? What if it were possible to detect cancer when it's still just a microscopic shadow, or perceive the first signs of Alzheimer's decades before symptoms appear? These are no longer science fiction fantasies, they are realities being born now. While you and I share this moment of reflection, artificial intelligence in medicine didn't arrive with fanfare. It infiltrated silently, like dawn replacing night without us noticing exactly when one becomes the other. In laboratories around the world, algorithms are being trained to recognize patterns in millions of medical images, to analyze complex genetic data, to predict how our bodies will react to different treatments. But here lies a profound mystery I want to explore with you. While these machines become increasingly intelligent, increasingly capable of helping us live longer and healthier lives, they also raise fundamental questions about what it means to be human, about the nature of trust, and about the boundaries between technology and the soul. Tonight, I will guide you through the digital corridors where science meets hope, where data transforms into cure, and where humanity's future is being carefully shaped by artificial minds that have never known the taste of worry or the weight of responsibility for saving a life. Prepare yourself for a journey that will begin with the first whispers of technological revolution in medicine, and take us to the most advanced frontiers of AI-assisted medical science. Together we will explore not only what these technologies can do, but also what they mean for us, for our children, and for the future of healing. Imagine for a moment that you are a radiologist. It's 3 in the morning and you're in front of a bright monitor in a dark room, analyzing hundreds of medical images. Your eyes are tired, your mind fights against exhaustion, but each image passing through your screen could contain the difference between someone's life and death. Every suspicious shadow, every small anomaly needs to be carefully examined, because an error could mean a misdiagnosis, a chance for cure slipping through your fingers. Now imagine that working beside you is an assistant who never gets tired, never blinks, never lets concentration waver. An assistant who can analyze thousands of images in seconds, who was trained by observing millions of cases, who learned to recognize patterns so subtle they sometimes escape even the most experienced eyes. This assistant doesn't replace you. It amplifies your capacity, whispers possibilities in your ear, illuminates details that could go unnoticed in the fog of human fatigue. This is the reality of AI-assisted radiology. One of the first frontiers where machines began to show their transformative potential in medicine. Have you ever wondered how it's possible to teach a machine to see diseases? It's a fascinating process, almost poetic in its complexity. Think about how a child learns to recognize a cat. First, they see a cat and someone says, "cat." Then another and another, until gradually their brain begins to identify patterns, the pointed ears, the whiskers, the shape of the eyes. With medical artificial intelligence, the process is similar but exponentially amplified. Deep learning algorithms are fed millions of medical images, X-rays, CT scans, MRIs, each one labeled by human specialists. For months or years, these artificial neural networks analyze every pixel, every shade of gray, every curve and contour, searching for patterns that correlate with specific diagnoses. They learn that certain textures in a mammogram might indicate breast cancer, that particular shapes in a brain CT could reveal early signs of stroke, that small changes in bone density might predict future fractures. The result is almost magical. Today, AI systems can detect skin cancer with accuracy superior to experienced dermatologists simply by analyzing digital photographs. They can identify diabetic retinopathy, one of the leading causes of blindness worldwide, by examining retinal images, enabling early diagnoses in remote communities where specialists are rare. But perhaps most impressive is how these machines are learning to see beyond what we considered possible. In 2019, researchers discovered that AI algorithms trained on chest X-rays could predict future heart attacks with surprising accuracy, even when experienced cardiologists couldn't see obvious signs of cardiovascular risk in the same images. It was as if the machines had developed a medical sixth sense, perceiving patterns too subtle for conscious human perception. This ability to see the invisible is revolutionizing not only diagnosis, but our fundamental understanding of how diseases manifest in the human body. Each discovery made by these algorithms illuminates new pathways for medicine, revealing previously unknown connections between symptoms, conditions, and prognoses. Can you feel the depth of this transformation? We are witnessing the birth of a new form of medical vision, where human intuition combines with computational analysis to create hybrid perception more powerful than either alone. Close your eyes and visualize something extraordinary. Inside every cell of your body exists a library. Not an ordinary library, but a collection of approximately 3 billion letters that form the most intimate code of your existence, your DNA. This personal library contains the instructions to build you, from the color of your eyes to your predisposition to certain diseases, from how your body processes medications to secrets about your longevity that you yourself don't yet know. For decades, reading this library was a slow, expensive, and limited process. But imagine if we could not only read these instructions quickly, but also compare them with millions of other similar libraries, searching for patterns, for clues, for stories hidden in the genetic variations that make us unique. This is exactly the revolution that artificial intelligence is bringing to genomic medicine. Have you ever wondered why some people can smoke their entire lives and never develop lung cancer, while others who never touched a cigarette are diagnosed with the disease? Why certain medications work wonderfully for some patients but cause severe side effects in others? The answers to these questions are often written in our genetic code, but discovering them requires analytical capacity that transcends the limitations of the human mind. Artificial intelligence has become our universal translator for the language of life. Sophisticated algorithms can now analyze complete genomes in a matter of hours, comparing genetic variations with databases containing information from millions of people. It's like having an infinitely patient and precise librarian who can not only read your genetic library, but also instantly compare it with all other libraries ever cataloged in human history. This capability is generating discoveries that seemed impossible just a decade ago. Researchers are identifying rare genetic variations that predispose people to specific diseases, sometimes decades before the first symptoms appear. They're discovering why certain ethnic groups respond differently to specific medications, paving the way for truly personalized medicine. Imagine receiving a report that says, based on your genetic makeup, you have a 40% higher probability of developing type 2 diabetes if you maintain your current lifestyle. But if you follow this specific diet and exercise regimen, you can reduce this risk by 70%. Or, this depression medication has an 85% chance of working well for you, with low risk of side effects based on your genetic profile. This is the promise of precision medicine powered by AI. But the applications go far beyond prevention and treatment personalization. Artificial intelligence is dramatically accelerating the development of new medications. Traditionally, creating a new drug took 10 to 15 years and cost billions of dollars, with a high failure rate. Now, algorithms can simulate how millions of different molecules will interact with specific proteins in the human body, identifying promising candidates for new medications in weeks or months. During the COVID-19 pandemic, we saw a dramatic example of this capability. Scientists used AI to analyze the genetic structure of the virus and identify potential targets for medications, accelerating the development of treatments and vaccines in ways unprecedented in medical history. It was as if we had compressed decades of traditional research into a few months of intensive computational analysis. But here lies a profound reflection. As our ability to read and interpret the code of life expands, so do our ethical responsibilities. Knowing that someone has a genetic predisposition to a disease can be liberating, allowing prevention and preparation. But it can also be a burden, especially when no cures are available. How do we navigate between the power of knowledge and the weight of inevitability? There's something deeply intimate about the sound of your heart beating. Thump, 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 a constant rhythm that accompanies every moment of your life, from the first breath to the last. This tireless organ beats approximately 100,000 times per day, pumping about 7,500 liters of blood through a network of vessels that, if stretched out, would cover more than 96,000 kilometers. But what if I told you that every beat of your heart tells a story? That the small variations in rhythm, the force of each contraction, the precise way blood flows through cardiac chambers, all of this carries information about your health that goes far beyond what we can consciously perceive. Cardiology has always been one of the medical specialties most dependent on patterns and subtle signals. An electrocardiogram, for example, is essentially a graphic representation of the heart's electrical activity, a series of waves and peaks that tell the story of how this vital organ is functioning. For decades, cardiologists have trained their eyes to recognize anomalies in these tracings. An elevated Saint segment might indicate a heart attack. A Q wave could reveal old damage to heart muscle. Specific arrhythmias might predict future risks. But imagine if we could amplify this pattern recognition capability 1,000-fold. Artificial intelligence is transforming cardiology precisely this way, creating systems that can analyze not only electrocardiograms, but also echocardiograms, cardiac MRI images, and even continuous data from wearable devices, searching for patterns so subtle they would escape the most experienced human perception. Have you ever wondered what it would be like to have a personal cardiologist who never leaves your side? Today, smartwatches equipped with sophisticated sensors can continuously monitor your heart rate, detecting arrhythmias like atrial fibrillation, a condition that often goes unnoticed but significantly increases stroke risk. AI algorithms analyze this data in real time, searching for anomalous patterns that might indicate emerging cardiac problems. But the real magic happens when these systems begin learning from data from millions of people. Imagine an artificial neural network that was trained with electrocardiograms from 1 million patients, along with their complete medical histories, test results, and long-term outcomes. This network can begin to identify cardiovascular risk patterns that no human could ever perceive. In 2019, Mayo Clinic researchers developed an algorithm that can predict the probability of a patient developing atrial fibrillation within the next 12 months, simply by analyzing a normal electrocardiogram. Think about the depth of this discovery. The algorithm can see precursor signs of a future arrhythmia in an ECG that experienced cardiologists would consider completely normal. This ability to predict the cardiac future is revolutionizing not only diagnosis but also prevention. Patients identified as high risk can receive preventive interventions, lifestyle changes, medications, or closer monitoring before symptoms even appear. It's like having a medical time machine that lets us see future cardiac problems and act in the present to prevent them. But AI cardiology goes beyond problem detection. It's also optimizing treatments. Algorithms can analyze data from thousands of cardiac procedures to identify the best strategies for each type of patient. They can predict how different hearts will respond to specific surgeries, which medications will be most effective, and even optimize intervention timing to maximize success chances. During complex procedures like angioplasties or bypass surgeries, AI systems can provide real-time guidance, analyzing live medical images and suggesting the best approaches based on millions of similar cases. It's like having all the accumulated experience of world cardiology, whispering advice in the surgeon's ear during the procedure. Breathe deeply and feel your heart beating as you reflect on this. Each beat now carries the potential to be understood in ways our ancestors never imagined, interpreted by intelligences that can see patterns across time and space, connecting your individual heart to humanity's collective cardiac experience. Close your eyes and imagine the busiest clinical laboratory you can visualize. Hundreds of blood, urine, and other body fluid samples constantly circulate through sophisticated machines, each containing microscopic secrets about someone's health. Specialized technicians work tirelessly, analyzing data, interpreting results, searching for signs of hidden diseases in numbers and charts. Now, amplify this image 1,000-fold. Imagine not just one laboratory, but a global network of digitally connected laboratories, where every test performed contributes to a growing reservoir of medical knowledge, where patterns identified in a blood sample in Sao Paulo can instantly inform the diagnosis of a similar patient in Tokyo. This is the transformative power that artificial intelligence is bringing to laboratory medicine. Have you ever wondered why doctors sometimes seem able to read so much about your health from a simple blood sample? Your blood is like a microscopic newspaper circulating through your body, carrying news from every organ, every metabolic process, every battle your immune system is fighting. But interpreting this news requires deep understanding of how thousands of different components interact and influence each other. Artificial intelligence is revolutionizing our ability to read this biological newspaper. Machine learning algorithms can simultaneously analyze hundreds of biological markers, searching for complex patterns that indicate specific health conditions. It's like having a microscopic detective who can examine every molecular clue and connect dots that would be impossible to perceive through traditional human analysis. Imagine an algorithm that can detect the first signs of Alzheimer's years before symptoms appear, simply by analyzing specific proteins in the blood. Or a system that can accurately predict whether a pneumonia patient will need ICU admission, based on a complex combination of inflammatory markers, cell counts, and other biomarkers. This multidimensional analysis capability is generating surprising discoveries. Researchers have found that specific patterns of metabolites in blood can indicate future depression risk, that certain protein combinations can predict response to specific cancer treatments, and that microRNA analyses can reveal information about longevity and cellular aging. But perhaps even more fascinating is how AI is accelerating the differential diagnosis process. When a patient presents with ambiguous symptoms that could indicate various different conditions, algorithms can analyze the complete laboratory profile and suggest the most likely diagnoses ordered by probability. It's like having an infinitely experienced medical consultant who can instantly access knowledge from millions of similar cases. During the COVID-19 pandemic, we saw a dramatic example of this capability. AI systems were developed to analyze specific patterns in blood tests that could distinguish between COVID-19 and other respiratory infections, even when symptoms were identical. Some algorithms could identify patients at risk of developing severe forms of the disease, based only on laboratory markers present at hospital admission. AI-assisted laboratory medicine is also democratizing access to sophisticated diagnostics. Portable devices equipped with intelligent sensors can perform complex analyses at the point of care, instantly transmitting results to AI systems that interpret them and provide diagnostic guidance. This is especially transformative in rural areas or developing countries, where access to specialized laboratories is limited. Think about the depth of this transformation. Every drop of blood analyzed contributes to the collective learning of these systems, making them more accurate and capable. It's a virtuous circle where every tested patient contributes to improving diagnosis for future patients, creating a collective medical intelligence that grows continuously. But there's something almost poetic about this process. While you sleep peacefully, algorithms around the world are working tirelessly, analyzing samples, discovering patterns, refining diagnoses. It's a global laboratory that never sleeps, a collective mind dedicated to deciphering the mysteries of human health, one drop of blood at a time. There's something deeply touching about the moment when a doctor sits beside a patient's bedside, looks into their eyes, and says, We're going to find the best way to help you. In this moment, decades of study, clinical experience, and human intuition combine with hope for a cure, determination to alleviate suffering, and the weight of responsibility to make decisions that can change a life forever. But imagine if that doctor could instantly access not only their own experience, but also the collective knowledge of all doctors who have ever treated similar cases worldwide. Imagine if they could consult the results of millions of treatments, analyze patient response patterns with similar genetic profiles, and receive guidance based on computational analysis of all medical literature ever published. This is the emerging reality of AI-based clinical decision support systems. They are not substitutes for medical judgment, but powerful amplifiers of human healing capacity, digital reminders of possibilities that could be forgotten in the pressure of the moment, silent consultants that whisper evidence-based suggestions too vast for any individual human mind to process completely. Have you ever wondered how many decisions a doctor needs to make during a single day? From choosing which diagnostic test to order to deciding medication dosages, from interpreting ambiguous symptoms to determining when a patient is ready for hospital discharge. Each decision carries consequences that extend far beyond the present moment. Artificial intelligence is transforming this decision-making process in subtle but profound ways. Sophisticated systems can analyze patient data in real time, vital signs, laboratory results, medical history, current medications, and alert to potential problems before they become critical. It's like having a vigilant assistant who never gets distracted, never forgets to check drug interactions, never misses a sign of clinical deterioration. In intensive care units, where every minute can be crucial, AI algorithms continuously monitor dozens of physiological parameters, searching for subtle patterns that may precede serious complications. They can detect the first signs of sepsis, a potentially fatal condition, hours before obvious symptoms appear, giving doctors a precious window of opportunity for early intervention. But perhaps even more impressive is how AI is personalizing treatments based on each patient's unique characteristics. Algorithms can analyze not only the specific medical condition, but also age, weight, health history, concomitant medications, and even social and economic factors that may affect treatment adherence. The result is truly individualized treatment recommendations. For cancer patients, for example, AI systems can analyze the specific genetic profile of the tumor, compare it with databases of thousands of similar cases, and suggest treatment combinations that have the highest probability of success for that specific tumor profile. It's precision medicine taken to its logical extreme, where each patient receives a unique treatment protocol, optimized for their individual characteristics. The speed with which these systems can process information is also revolutionizing emergency situations. In case of cardiac arrest, for example, algorithms can instantly analyze the patient's heart rhythm, medical history, medications in use, and other variables to suggest the most effective sequence of interventions. Every second saved in decision-making can mean the difference between life and death. During the pandemic, we saw powerful examples of this capability. AI systems were developed to help doctors decide which COVID-19 patients were most likely to need mechanical ventilation, enabling more effective planning of scarce hospital resources. Other algorithms analyzed chest CT scans to help distinguish COVID-19 pneumonia from other causes, accelerating diagnoses when specific tests weren't available. But here lies a profound reflection on the nature of modern medicine. As our tools become more sophisticated, more precise, more capable, the fundamental role of the physician doesn't diminish, it transforms. The doctor of the future won't be replaced by AI, but will be a conductor of medical technology, orchestrating powerful tools in service of human healing. Imagine for a moment that you're floating silently above an ultra-modern operating room. Below, a team of surgeons works with millimetric precision, their hands moving with the confidence that comes from years of intensive training. But look closer, and you'll notice something extraordinary alongside the human surgeons. Robotic arms move with supernatural precision, each movement calculated by algorithms that process data in real time, each incision guided by an intelligence that never trembles, never hesitates, never gets tired. This is not a scene from the distant future. It's the current reality of many advanced surgical centers around the world. A. Assisted robotic surgery represents one of the most visible and dramatic transformations of modern medicine, where human dexterity combines with mechanical precision to create surgical possibilities that were unimaginable just a few decades ago. Have you ever wondered what it would be like to have hands that never shake? The most experienced surgeon, however skilled, is still limited by the natural imperfections of the human body, the microscopic tremor of hands, fatigue that accumulates during long procedures, limitations of vision and physical reach. Robotic surgical systems eliminate these human limitations, while preserving and amplifying the surgeon's clinical judgment and experience. In prostate surgeries, for example, surgical robots can operate through tiny incisions, maneuvering in spaces so tight they would be inaccessible to human hands. Each surgeon's movement is filtered through algorithms that eliminate tremors and increase precision, allowing preservation of delicate nerves responsible for sexual function and urinary continence with precision that would be impossible through traditional surgery. But the real revolution is happening when artificial intelligence began not only to execute movements, but also to guide surgical decisions in real time. Advanced systems can analyze live images of the surgical field, identify anatomical structures, detect abnormal tissues, and even predict potential complications based on what they see during the procedure. Imagine an algorithm that was trained by observing thousands of cardiac surgeries, learning to recognize anatomical variations, identify tissues at risk, and predict how different surgical strategies might affect the final outcome. During surgery, this system can whisper advice to the surgeon. Careful, there's a small but important artery 3 millimeters to the left. Or, based on similar cases, an alternative approach might reduce the risk of postoperative bleeding. Neurosurgery represents perhaps the most dramatic example of this transformation. The human brain is the most complex and delicate organ in the body, where an error of millimeters can mean the difference between complete recovery and permanent neurological deficits. AI systems can map each patient's brain in real time, identifying critical functional areas that must be preserved, guiding the surgeon through safe routes to reach tumors or other lesions. During epilepsy surgeries, for example, algorithms can analyze live brain electrical signals, helping surgeons locate and remove epileptic foci while preserving areas responsible for language, memory, and other essential cognitive functions. It's like having a neurological GPS that navigates through the most precious territories of the human mind. But perhaps even more fascinating is how AI is enabling surgeries that were previously considered impossible. Procedures on extremely delicate anatomical structures, like microscopic blood vessels or hair-thin nerves, are becoming routine through the combination of advanced computer vision and ultra-precise robotic manipulation. Augmented reality is adding an even more surreal layer to this transformation. Surgeons can now see through tissues with MRI or CT images overlaid in real time over the surgical field. It's like having X-ray vision, allowing them to see exactly where critical structures are even when hidden under layers of tissue. Can you imagine the depth of this change? Generations of surgeons learned to operate based mainly on touch and experience, developing an almost mystical intuition about human anatomy. Now, this human intuition combines with precise data and real-time visualization, creating a new form of surgery that is simultaneously more scientific and more artistic. During the pandemic, telemedicine surgery gained a completely new dimension. Experienced surgeons could guide complex procedures remotely, with AI systems translating their movements in real time to surgical robots in remote hospitals. It was as if the concept of physical distance had become irrelevant to medical expertise. But here lies a profound reflection. While these technologies make surgery more precise, safer, more predictable, they are also fundamentally changing what it means to be a surgeon. The surgeon of the future will be part artist, part engineer, part advanced technology pilot, someone who orchestrates a symphony of algorithms and robots in service of human healing. There are diseases that hide in the shadows of the human body, silent entities that grow and develop far from the eyes of any conventional medical technology. For decades, these microscopic invaders, viruses, bacteria, fungi, parasites, have managed to camouflage themselves, adapt, and sometimes overcome our best attempts at detection and treatment. But imagine if we could hear their most subtle whispers, detect their presence through signs so delicate that only artificial intelligences specifically trained for this microscopic hunt could perceive them. Close your eyes and visualize the immune system as a complex and sophisticated army, with specialized soldiers constantly patrolling your body, searching for invaders, communicating through elaborate chemical signals, coordinating defensive responses that are simultaneously devastatingly effective, and precisely calibrated to avoid collateral damage to your own tissues. Artificial intelligence is giving us a new way to listen to these microscopic conversations, to interpret the chemical signals that immune cells send to each other, to recognize activation patterns that indicate the presence of specific pathogens or the development of autoimmune diseases where the immune system mistakenly turns against the body itself. Have you ever wondered why some infections are so difficult to diagnose? Many pathogens cause vague and nonspecific symptoms, fever, fatigue, muscle pain, that can be caused by hundreds of different conditions. Traditionally, identifying the specific culprit required a series of laboratory tests, often time-consuming and expensive, a process of elimination that could take days or weeks while the patient continued to suffer. Machine learning algorithms are revolutionizing this infectious disease diagnosis process. Sophisticated systems can analyze complex patterns of inflammatory markers, immune cell profiles, and even genetic analyses of microorganisms present in the body, identifying specific pathogens with speed and accuracy that surpasses traditional methods. During infectious disease outbreaks, this capability becomes even more critical. AI can track transmission patterns, predict where an epidemic might spread next, and even identify mutations in pathogens that could affect their virulence or resistance to treatments. It's like having a digital epidemiologist working 24 hours a day, analyzing public health data in real time to detect emerging threats. Antimicrobial resistance represents one of the greatest challenges in modern medicine. Bacteria that were once easily treatable with common antibiotics are becoming resistant to multiple drugs, creating superbugs that can be lethal. AI is helping combat this threat in several ways, predicting which antibiotics are most likely to be effective against specific infections, identifying new molecular targets for drug development, and even discovering antibacterial properties in compounds that were never considered as possible antibiotics. But perhaps even more fascinating is how artificial intelligence is helping us understand the microbiome, the complex community of trillions of microorganisms that live in our body and that we've recently discovered play crucial roles in digestion, immunity, and even mood and behavior. Algorithms can analyze the microbial composition of fecal samples and identify patterns associated with specific diseases, from irritable bowel syndrome to depression. This understanding of the microbiome is opening completely new therapeutic possibilities. Instead of simply killing bad bacteria with antibiotics, we're learning to cultivate healthy microbial communities, to use AI-designed smart probiotics to restore specific microbial balances, and even to transfer entire microbiomes from healthy people to patients with certain conditions. Precision antimicrobial medicine is emerging as a new frontier, where treatments are personalized not only based on the patient's genetics, but also on the specific composition of their microbial flora and the genetic profile of the pathogens infecting them. It's an approach as individualized as a fingerprint, recognizing that each infection is unique and requires a specific therapeutic strategy. Breathe deeply and reflect on the complexity of this microscopic dance happening inside your body at this exact moment. Trillions of microorganisms, some beneficial, others potentially harmful, all interacting in an ecosystem that artificial intelligence is just beginning to decipher, revealing secrets that could transform our fundamental understanding of health and disease. Imagine a pharmacy where every medication is unique, specifically created for you. Not just the dosage adjusted to your weight or age, but the very molecular composition of the medicine optimized for your specific genetics, your individual metabolism, your particular health conditions. A pharmacy where intelligent algorithms can predict exactly how your body will react to each active component, what side effects you might experience, and what dosage will provide maximum benefit with minimum risk. This is not scientific fantasy, it's the emerging future of personalized pharmacology, where artificial intelligence is revolutionizing not only how medications are discovered and developed, but also how they are prescribed and administered to each individual patient. Have you ever wondered why the same medication can be miraculous for one person and completely ineffective for another? Why some patients experience severe side effects while others feel nothing but the desired benefits? The answers are written in our genetic code, in subtle differences in how our bodies process, metabolize, and respond to different chemical compounds. For decades, medicine followed a one-size-fits-all approach to medication prescription. Dosages were determined mainly by weight and age, with adjustments based on trial and error when results weren't satisfactory. But AI is fundamentally changing this paradigm, enabling truly personalized pharmacological medicine. Sophisticated algorithms can now analyze specific genetic profiles related to drug metabolism. Genes that determine how quickly you process certain drugs, how sensitive you are to specific side effects, which metabolic pathways are more or less active in your body. With this information, AI systems can calculate ideal dosages and even suggest alternative medications that might be more effective for your individual profile. For patients with depression, for example, choosing the right antidepressant traditionally involved a trial and error process that could take months, with patients experiencing different medications until finding one that worked without intolerable side effects. Now, algorithms can analyze specific genetic variations related to neurotransmitter metabolism and predict which antidepressants are most likely to be effective for each individual patient. But the revolution goes far beyond personalizing existing medications. AI is dramatically accelerating the new drug discovery process, a process that traditionally took 10 to 15 years and cost billions of dollars, with a high failure rate in final development stages. Machine learning systems can now simulate how millions of different molecules will interact with specific proteins in the human body, identifying promising candidates for new medications in a matter of weeks. It's like having an infinite virtual laboratory where experiments that would take years to perform physically can be simulated in hours. During the COVID-19 pandemic, we saw a dramatic example of this capability. Researchers used AI to analyze the structure of the SARS-CoV-2 virus and identify potential attack points for new medications. Algorithms scoured databases of millions of existing compounds, searching for molecules that could interfere with viral replication. This process, which would normally take years, was completed in a matter of months. AI is also revolutionizing clinical trials, the process by which new medications are tested in humans to verify safety and efficacy. Algorithms can analyze patient data in real time during clinical trials, identifying early signs of efficacy or toxicity, optimizing study protocols, and even predicting which patients are most likely to respond positively to experimental treatments. Imagine clinical trials where each patient receives a slightly different dosage, optimized by AI based on their individual characteristics, where algorithms continuously monitor responses and adjust protocols in real time to maximize benefits and minimize risks. This is the future of adaptive studies powered by artificial intelligence. Medicinal nanotechnology is combining with AI to create extraordinarily sophisticated drug delivery systems. Smart nanoparticles can be programmed to release medications only in specific cells, at specific times in response to specific biological signals. It's like having molecular missiles that can navigate through the body and deliver their therapeutic payload with surgical precision. For cancer patients, for example, nano-delivery systems can release chemotherapy only inside tumor cells, sparing healthy cells and dramatically reducing side effects. AI algorithms guide these nanoparticles, analyzing chemical signals from the cellular environment to determine when and where to release their medications. Reflect on the depth of this transformation. We are moving toward a future where each person will receive unique medications, optimized specifically for their individual biology, delivered by intelligent systems that can navigate the body with molecular precision. Its pharmacology as personalized as our fingerprint, recognizing that every body is unique and deserves unique treatments. There is a territory of medicine that has long remained shrouded in mystery and stigma, a frontier where science meets the soul, where symptoms cannot be easily measured with blood tests or visualized on X-rays. Mental health represents one of the greatest challenges and one of the greatest opportunities in modern medicine. And it is here that artificial intelligence is beginning to write some of its most delicate and promising chapters. Close your eyes for a moment and think about the extraordinary complexity of the human mind. Every thought, every emotion, every memory emerges from a network of approximately 86 billion neurons, connected by trillions of synapses, processing information through circuits so complex that we are only beginning to understand their functioning. When something goes wrong in this incredibly sophisticated biological machine, symptoms are often subtle, subjective, and difficult to quantify. Have you ever wondered why diagnosing mental health conditions can be so challenging? Unlike a bacterial infection that can be identified through culture, or a broken bone that appears clearly on an X-ray, mental disorders manifest primarily through changes in behavior, mood, cognition, and perception. Symptoms that depend heavily on patient self-report and clinical interpretation by the health professional. Artificial intelligence is beginning to offer new windows for understanding and treating these complex conditions. Sophisticated algorithms can now analyze speech patterns, detecting subtle changes in tone, speed, pause patterns, and word choice that might indicate depression, anxiety, or other mental disorders. It's as if machines are learning to listen not only to what we say, but how we say it, capturing signals that might escape even experienced therapists. Fascinating studies have shown that algorithms can detect early signs of depression by analyzing just a few minutes of recorded speech, identifying acoustic patterns so subtle they are imperceptible to the conscious human ear. Almost imperceptible changes in prosody, the rhythm and melody of speech, can reveal profound information about a person's mental state. But AI goes beyond speech analysis. Advanced systems can monitor activity patterns through smartphones and wearable devices, detecting changes in sleep, physical activity levels, social interactions, and even movement patterns that might indicate developing depressive or manic episodes. It's like having a silent and careful observer who can detect early warning signs, enabling preventive interventions before crises fully develop. Imagine an app that can detect you're entering a depressive episode days before you notice it yourself, based on subtle changes in your sleep patterns, physical activity, and even how you type on your phone. This app could gently suggest coping strategies, connect you with support resources, or alert your caregivers if necessary. For people with bipolar disorder, AI systems can be particularly transformative. These algorithms can learn each individual's unique patterns, recognizing specific signs that precede manic or depressive episodes. It's precision medicine applied to mental health, where treatments and interventions are personalized based on each person's individual patterns. AI-assisted therapy is emerging as a promising new frontier. Sophisticated therapeutic chatbots can provide 24/7 support, offering cognitive behavioral therapy techniques, mindfulness exercises, and emotional support when human therapists aren't available. While they can never completely replace the therapeutic human connection, these systems can democratize access to basic mental health care, especially in areas where specialists are scarce. During the pandemic, when social isolation and economic uncertainty created a secondary epidemic of mental health problems, AI apps became lifelines for millions of people. Systems that could provide immediate support, relaxation techniques, and even suicide crisis detection became more valuable than ever. Social media analysis is offering unique insights into population mental health. Algorithms can analyze aggregated patterns in social media posts, identifying outbreaks of anxiety or depression in specific communities, detecting effects of traumatic events on populations, and even predicting areas where mental health resources might be most needed. But perhaps even more profound is how AI is helping to destigmatize mental health issues by objectifying and quantifying aspects of conditions that were previously considered purely subjective. When algorithms can detect depression through speech patterns or activity, it reinforces the reality that mental disorders are real medical conditions with measurable biological manifestations. AI-assisted neuroimaging research is revealing new insights into how mental disorders manifest in the brain. Algorithms can identify subtle patterns in brain images that correlate with specific conditions, potentially offering objective biomarkers for diagnoses that traditionally depended mainly on clinical observation and self-report. Reflect on the delicacy and importance of this transformation. We are developing digital guardians for our mental health, systems that can know us intimately, detect when we need help, and offer compassionate support even in our loneliest moments. It's technology in service of the human soul, algorithms dedicated to preserving and nurturing our emotional and psychological health. There are moments in human history when progress forces us to pause and ask profound questions about who we are and who we want to become. The development of artificial intelligence in medicine is certainly one of these moments and inflection point, where we must carefully balance the extraordinary promises of technology with ethical responsibilities that transcend any specific innovation. Imagine for a moment that you are a medical ethics committee, gathered to discuss a complex dilemma. An AI algorithm can predict with 90% accuracy which patients will develop Alzheimer's in the next 10 years, based only on a simple blood test. This information could be immensely valuable for future care planning, preventive treatment development, and family preparation. But it could also lead to health insurance discrimination, unnecessary anxiety in patients, and life decisions based on probabilities that might not materialize. Would you share this information? With whom? How? These are the questions that define our historical moment in medicine. The question of medical data privacy takes on a completely new dimension in the AI era. Machine learning algorithms require vast data sets to train effectively, millions of medical records, images, laboratory results, and genetic information. Every advance in precision medicine depends on the ability to analyze data from thousands or millions of previous patients. But every use of this data raises questions about consent, anonymization, and control over intimate personal information. Consider the complexity. Your medical data, when combined with data from millions of other people, can contribute to discoveries that save future lives. But that same data, if poorly protected or misused, could be used to discriminate against you in insurance, employment, or relationships. It's a modern dilemma where individual good and collective good can come into tension. The issue of algorithmic bias represents perhaps the most subtle and dangerous ethical challenge of medical AI. Algorithms learn from historical data, and if this data reflects existing social inequalities or prejudices, algorithms can perpetuate and even amplify these injustices. If AI systems are trained primarily with data from patients of one ethnicity, they may be less accurate for patients of other ethnicities. If historical data reflects disparities in healthcare access, algorithms may inadvertently recommend lower quality care for already marginalized groups. Have you ever thought about how a neutral algorithm can actually be profoundly unfair? During the development of AI systems to predict cardiovascular risk, researchers discovered that algorithms trained primarily with data from male patients were significantly less accurate for women, because heart disease symptoms can manifest differently between genders. Algorithmic neutrality had masked real systemic bias. Medical responsibility becomes exponentially more complex when decisions are made by algorithms. If a doctor makes an error, there is a clear path of responsibility and accountability. But what if the error comes from an AI algorithm? Who is responsible? The doctor who trusted the recommendation, the company that developed the algorithm, the researchers who trained it, or the institutions that provided the training data? This question is not merely academic. In 2018, an algorithm widely used to assess kidney disease risk was discovered to be less sensitive for Black patients, potentially leading to undertreatment of kidney disease in an already at-risk population. When such discoveries emerge, a complex chain of responsibility unfolds that can affect millions of patients. Patient autonomy, the fundamental right to make informed decisions about one's own medical care, faces new challenges in the AI era. How do we explain algorithmic decisions to patients? How do we ensure truly informed consent when not even AI developers can fully explain how their algorithms reach specific conclusions? Many AI systems operate as black boxes. They produce accurate results, but the internal processes by which they reach these conclusions are opaque even to their creators. An algorithm might recommend a specific cancer treatment based on patterns it detected in millions of cases, but cannot explain exactly which characteristics led to this recommendation. How can a patient give truly informed consent for a treatment recommended by a process that cannot be fully explained? The question of equitable access to medical AI represents another fundamental ethical dilemma. If AI systems can dramatically improve diagnoses and treatments, but are expensive to develop and implement, there is a risk of creating a new form of health inequality, a division between those who have access to AI-assisted medical care and those who do not. Wealthy countries with advanced technological infrastructure can implement sophisticated AI systems, while developing countries fall behind. Even within the same country, well-funded urban hospitals can offer AI-assisted diagnoses, while rural clinics continue to depend only on traditional methods. How do we ensure that the benefits of medical AI are distributed fairly? Growing dependence on AI systems also raises concerns about the erosion of traditional medical skills. If radiologists increasingly rely on algorithms to interpret images, do they maintain their independent diagnostic skills? If doctors trust decision support systems for treatment recommendations, can their independent clinical reasoning ability atrophy? This is not just a theoretical concern. Studies have shown that when pilots depend excessively on automated navigation systems, their manual navigation skills can degrade, sometimes with catastrophic consequences when technology fails. Medicine faces similar dilemmas about how to balance the benefits of AI assistance with the need to maintain independent human medical competence. Reflect on these questions as you consider the future of medicine. How do we navigate between AI's transformative potential and the need to preserve fundamental human values? How do we ensure that technology serves humanity and not the other way around? These are the questions that will define not only the future of medicine, but the future of our relationship with artificial intelligence in all aspects of human life. There's something deeply exciting about being alive at a moment in history, when the frontiers of the impossible are constantly being redefined. At this exact instant in laboratories around the world, researchers are developing technologies that seem straight out of the most imaginative science fiction, but that will become common medical reality in the coming decades. Imagine for a moment computer chips so small they can navigate through your bloodstream, nanobots programmed to seek and destroy individual cancer cells with guided missile precision, or algorithms that can not only diagnose diseases, but predict their future evolution with supernatural accuracy, enabling preventive interventions decades before symptoms appear. This is not fantasy. These are emerging technologies being tested now, at various stages of development, ready to transform our fundamental understanding of what it means to treat, cure, and even prevent diseases. AI-assisted regenerative medicine represents one of the most fascinating frontiers. Algorithms are learning to program stem cells, instructing them on how to differentiate into specific cell types with precision that surpasses the best human efforts. Imagine entire organs being printed using AI-guided 3D bioprinters, each cellular layer positioned with molecular precision to create functional tissues indistinguishable from originals. We're already seeing the first examples of this revolution. Researchers have managed to use AI to design biological scaffolds that guide the growth of new blood vessels, creating cardiac patches that can repair hearts damaged by heart attacks. Algorithms analyze natural vascular architecture and recreate structures that allow new tissues to integrate seamlessly with existing tissues. Can you imagine a future where strokes can be completely reversed through AI-guided regenerative therapies? Where paralysis from spinal cord injury becomes temporary because algorithms can guide the growth of new neural circuits? Where aging itself becomes a treatable condition because we completely understand the molecular mechanisms that drive it? Brain-computer interfaces represent another extraordinary frontier. AI algorithms are learning to interpret neural signals directly, translating thoughts into digital commands. For people with paralysis, this means the possibility of controlling external devices, computers, robotic prostheses, even artificial limbs, using only their thoughts. But the implications go far beyond restoring lost function. Bidirectional systems can not only read signals from the brain, but also send information back, creating direct interfaces between human mind and artificial intelligence. Imagine having instant access to all human medical knowledge, or being able to download specialized skills directly to your brain. Quantum medicine is emerging as a completely new field where quantum algorithms can simulate molecular interactions with precision impossible for conventional computers. These systems can model how medications interact with specific proteins at levels of detail that enable drug design with near-perfect specificity and minimal side effects. Quantum computers operating AI algorithms can analyze all possible conformations of a protein simultaneously, identifying exactly where and how a drug molecule should fit to produce the desired therapeutic effect. It's like having an infinitely powerful virtual laboratory where every possible experiment can be performed instantly. AI-assisted space medicine is preparing for the challenges of keeping humans healthy during long interplanetary journeys. Algorithms are being developed to diagnose and treat medical conditions using extremely limited resources. In environments where medical evacuation is impossible and communication with Earth may have delays of several minutes or hours. Autonomous medical AI systems for space missions must be capable of performing robotic surgeries, manufacturing medications from basic precursors, and even implementing regenerative medicine protocols using compact 3D bioprinters. It's frontier medicine in the most literal sense, where algorithms must be able to handle any imaginable medical emergency using only resources available on a spacecraft. AI-assisted longevity is transforming our understanding of aging, from an inevitable process to a potentially treatable condition. Algorithms are identifying the fundamental molecular mechanisms of aging DNA damage, telomere shortening, misfolded protein accumulation, mitochondrial decline, and developing specific interventions to slow or reverse each process. Imagine therapies that can reset your cells to younger states, removing damage accumulated over decades and restoring youthful function to aged organs. AI algorithms are identifying combinations of factors that can reprogram senescent cells, transforming them from retired cells that secrete inflammatory compounds back to functional and productive cells. Predictive preventive medicine is evolving to a level where algorithms can predict diseases decades in advance, analyzing not only genetics, but also environmental exposures, lifestyle patterns, and even social and psychological factors. It's like having a medical time machine that can see your health future and guide present interventions to create a different, healthier future. AI systems are being trained on longitudinal data from millions of people, followed for decades, identifying subtle patterns that precede disease development for extraordinarily long periods. An algorithm can detect early signs of dementia in data collected when a person was 30 years old, enabling preventive interventions that can completely alter the cognitive trajectory of their life. Telepathic medicine, if we can call it that, is emerging through brain-computer interfaces so sophisticated they can detect intentions before they even become conscious thoughts. For people with severe depression or suicidal ideation, systems that can detect changes in mental state before the person themselves perceives them can provide life-saving interventions at the exact moment they are most needed. Reflect on the depth of this transformation. We are moving toward a future where the distinction between health and disease, between treatment and prevention, between natural and artificial, may become completely obsolete. Where every cell in your body can be continuously monitored and optimized, where aging can be paused or reversed, where diseases can be eliminated before they even exist. But with each technological advance, new questions emerge about what it means to be human, about the limits we should or should not cross, about how to ensure these extraordinary powers are used for the good of all humanity. There is a beautiful and complex tension at the heart of modern medicine, a delicate balance between embracing the technological future and preserving the human essence that has always been the center of healing. As algorithms become more sophisticated, more capable, more integrated into every aspect of medical care, a fundamental question emerges. How do we keep the human soul of medicine alive in a world increasingly dominated by artificial intelligences? Close your eyes and imagine the ideal doctor. Perhaps you visualize someone with vast and updated knowledge, capable of accurate diagnosis and effective treatment. But you probably also imagine qualities that no algorithm can replicate: empathy, Compassion, the ability to sit beside a patient and simply be present during moments of fear and vulnerability. Human intuition that can detect subtle signs that transcend quantifiable data. This is the delicate dance that defines the future of medicine. How do we amplify human capabilities through technology without losing what makes us deeply, essentially human? Artificial intelligence can analyze millions of medical images in seconds, can predict disease risks with surprising accuracy, can suggest optimized treatments based on vast evidence. But when a mother receives a cancer diagnosis for her child, it's the human hand on her shoulder, the compassionate look in the doctor's eyes, the comforting presence of someone who understands both science and human suffering that makes the difference between despair and hope. Have you ever wondered why some medical interactions leave us feeling cared for and understood, while others, even though technically perfect, leave us feeling cold and dehumanized? The answer lies in something that goes far beyond diagnostic accuracy or treatment efficacy. It lies in human connection, in the ability to see not just the disease, but the person who carries it. The doctor of the future will not be replaced by AI, but will be transformed by it. Freed from the most routine and analytical tasks by algorithms, this future doctor will be able to dedicate more time to what only humans can do: truly listen, understand the unique context of each life, navigate through the emotional and social complexities that surround each illness, and provide the kind of holistic care that treats not just symptoms, but complete human beings. Narrative medicine, the practice of understanding and honoring the stories patients tell about their experiences with illness and healing, may become even more important in the AI era. While algorithms analyze objective data, human doctors can specialize in interpreting the subjective data of human experience, what it feels like to be sick, what recovery means for each specific person, how to integrate medical treatments into the unique complexities of each individual life. During the pandemic, we saw powerful examples of this dynamic. While AI algorithms helped with diagnoses and epidemiological predictions, it was human doctors, nurses, and other health professionals who provided comfort to isolated patients, who communicated with separated families, who made difficult ethical decisions about allocation of scarce resources. Technology provided tools, but humanity provided soul. Medical education is evolving to reflect this new reality. Medical students are learning not only anatomy and pharmacology, but also how to collaborate effectively with AI systems, how to interpret and question algorithmic recommendations, how to integrate technological insights with human clinical judgment. They are learning to be conductors of a complex technological orchestra, always keeping focus on human well-being. The doctor-patient relationship may actually become more intimate and personalized in the AI era. When algorithms handle routine data analysis, doctors can dedicate more time to understanding each patient's unique concerns, to exploring how medical conditions intersect with personal life, work, relationships, and dreams. They can become true partners in each person's health journey. But this transformation requires constant vigilance. There is always the risk that technological efficiency gradually replaces human care, that the speed of algorithms creates pressure for faster and more superficial medical interactions, that the apparent objectivity of data obscures the rich and important subjectivity of the human experience of being sick. The art of medicine, and it is truly an art as much as a science, lies in balancing technological precision with human sensitivity, in using powerful tools in service of deeply human values. An algorithm can detect cancer with exceptional accuracy, but it's human hands that hold the patient's hands while explaining the diagnosis. An AI system can optimize treatment protocols, but it's human judgment that adapts these protocols to the unique circumstances of each individual life. Reflect on this balance as we consider the future. The greatest promise of medical AI may not lie in replacing humanity in medicine, but in amplifying it, in freeing healthcare professionals to do more of what only humans can do: care, heal, and connect at levels that transcend technology. The question is not whether we should embrace AI in medicine. That decision has already been made. The question is how we ensure that, in doing so, we become more human, not less. How we use these powerful tools to expand our capacity for healing, our ability to alleviate suffering, our competence in restoring hope. And here we reach the end of this contemplative journey, but also the beginning of something much larger. As you listen to these final words, somewhere in the world, an artificial intelligence algorithm is detecting cancer in its earliest stages when it's still completely curable. Elsewhere, a robotic system is performing surgery with precision that saves a life that could have been lost. In a laboratory, researchers are discovering new medications that could revolutionize the treatment of diseases we today consider incurable. The future of medicine is not coming, it's already here, whispering its promises through every AI-assisted diagnosis, every personalized treatment based on algorithms, every life saved through collaboration between human and artificial intelligence. Breathe deeply with me and feel the extraordinary weight of this historical moment. You are alive during a medical revolution that rivals the greatest. Transformations in human history, the discovery of antibiotics, the development of vaccines, the invention of anesthesia. But this revolution is different because it's not about just one specific discovery, but about creating intelligences that can accelerate all future discoveries. Have you ever wondered how your grandchildren will view our current medical era? Perhaps the same way we view 19th century medicine, primitive in some aspects, but full of human dedication and thirst for knowledge that planted the seeds for everything that came after. They might be surprised that we once depended on manual diagnoses for conditions that their algorithms will routinely detect decades before symptoms. They might find it almost inconceivable that people died from diseases that their regenerative therapies will completely reverse. But amidst all this technological transformation, some elements will remain eternally constant. The profound gratitude of a family when a loved one is cured. The relief of knowing that pain can be alleviated. The hope that arises when grim diagnoses transform into promising prognoses. The deep sense of purpose that motivates every researcher, every doctor, every person dedicated to alleviating human suffering. Artificial intelligence in medicine is, at its essence, an extension of the most fundamental human impulse, the desire to care for one another, to alleviate pain, to preserve and extend life. Every algorithm trained to detect diseases carries within it the compassion of the researchers who created it. Every robotic system that performs surgeries is guided by the accumulated knowledge of generations of dedicated surgeons. During our journey together, we explored how AI is transforming diagnoses, personalizing treatments, revolutionizing surgeries, accelerating drug discovery, and expanding the frontiers of what we consider possible in medicine. But perhaps the most profound transformation is how it's changing our relationship with our own mortality and fragility. For the first time in human history, we are developing tools that can not only treat diseases after they appear, but predict and prevent many of them before they manifest. We are creating systems that can diagnose conditions at stages where intervention is most effective. We are building intelligences that can dramatically accelerate the development of new treatments for diseases that are fatal today. This is not just a medical revolution, it's a revolution in human hope. But with this hope comes responsibility. As a society, we must ensure that the benefits of this revolution are shared equitably, that the wonders of AI-assisted medicine do not become privileges of the few, but rights of all. We must remain vigilant about ethical issues, ensuring that algorithms are free from bias, that privacy is protected, that human autonomy is preserved. We must also remember that however powerful it becomes, artificial intelligence can never completely replace human compassion, empathy, the capacity to simply be present with someone in moments of vulnerability. The medicine of the future will be most effective when it combines the best of algorithmic precision with the best of human healing. As you reflect on our conversation tonight, carry with you a sense of optimism tempered with responsibility. We are living during an extraordinary moment where science fiction is becoming medical reality, where algorithms are learning to heal, where the very nature of disease and cure is being redefined. But also remember that every technological advance is ultimately about people, about the child whose cancer is detected early through AI and who grows up to have a full life, about the elderly person whose Alzheimer's is prevented through predictive interventions, about the mother whose heart attack is predicted and avoided through intelligent continuous monitoring. Artificial intelligence in medicine is our new ally in the millennial fight against pain, disease, and death. It's not a substitute for humanity in medicine, but an amplifier of our healing capacity, an extension of our compassion, a powerful tool in service of our most fundamental mission, caring for one another. Thank you for accompanying me on this journey of discovery and reflection. Thank you for your attention, your contemplation, your willingness to explore these complex and important questions with me. In a world increasingly connected by technology, it's human connection, like what we shared in this moment, that gives meaning to all our advances. And now, as you prepare to return to your world, to your life, to your own journeys of health and healing, I leave you with a final question that resonates through everything we explored together. In a future where machines can diagnose with superhuman accuracy, where algorithms can predict our health future with scientific clairvoyance, where robots can perform surgeries with mechanical perfection, how do we ensure that, in our quest for perfect medicine, we don't lose sight of what makes healing truly human, our capacity to love, to hope, to be present with one another in our most vulnerable moments?